What is going on, everybody? It's me, Jim Hoffman. Been very busy with a bunch of videos and content coming out. Just had the uh, EMS quick study guide come in as well. And I thought I'd jump on here real quick, do a quick video talking about uh, compartment syndrome and kind of just telling the difference a little bit between crush injury and the compartment syndrome, right? If we talk about crush injuries, that's the stuff where it's kind of systemic, okay? And that's when you call it that crush syndrome, the crush injury, all right? When it's kind of local, that's when we're talking about it being compartment syndrome. Now, there's a lot of things that can cause compartment syndrome. Burns can be one thing, infections, snake bite, even blunt injury, soft tissue injury, even things like IV infiltration. Right. One of the big things that you might see a lot of times with compartment syndrome are fractures. Okay. Um, that's something you have to keep an eye out for that, because if you're not careful, you don't recognize the compartment syndrome, it could end up, the patient could end up losing their limb from it, right? Now, I want to talk a little bit some boring stuff here about the sort of anatomy stuff about skeletal muscle, because it's kind of, I'm going to bring it back. I'm not get too much into the weeds. No, we don't want to be doing that here on this quick little Facebook Live. But we talk about skeletal muscle and the groups of muscles. Skeletal muscle is covered by something called fascia, right? Not very flexible, and it's kind of a sheet, all right? And it's beneath the skin, and it attaches and stabilizes, kind of encloses, and it also separates muscles and other internal organs. Okay. Now, this is what we have to think about when we think about compartment syndrome, because when you get a damage to a muscle group, all right, that can cause swelling of that fascia. And then that can bleed into the little compartments, right? And because of the structure and the makeup of fascia, we just talked about it not being very flexible, it doesn't stretch a lot, right? So when it swells, that pressure that we talk about pushes um, inward, right? And that can collapse the little bitty compartments inside, and then the blood flows into those compartments, compresses vessels and compresses nerves, right? And then as that little compartment, remember we said in the beginning, I talked about it being very local, right? As that compartment continues to fill, then you get, the small uh, blood flow with the venule level, okay, it decreases. And then that follows even more, or a reduction, or more of a lessening of flow for arteries and veins. Okay, so when you don't have that steady supply of oxygen and nutrients going to those tissues and those muscles, right, those distal um nerve uh, uh muscles and those nerve cells become ischemic, right? And they could die within a matter of, I don't know, probably hours, right? So when we talk about that and talk about how the importance of recognizing it, all right, we have to think of what the signs and symptoms are and what the mechanism is, right? I talked before about being maybe burns or tight clothing or IV infiltration, things like that, a fracture, right? But think about what a patient might say to you. A lot of times their complaint can be pain, right? But it's going to be pain kind of out of proportion or out of the ordinary for what the injury is, right? They might have a small maybe a closed fracture you don't really see, or maybe they have a burn that's not that bad, or the clothing that might be a little tight, but it doesn't look like that injury to you should be that painful. So they're complaining of pain that's out of proportion to that injury. That's something you should be thinking that maybe they're developing compartment syndrome. Okay, that's kind of the most common symptom you're going to see. They might describe it as it being very severe, like I said, out of proportion to the injury. Say it's burning. It might get worse when they move. It might get worse if you touch it, if you put pressure on it, okay? Or if they kind of stretch it a little bit, right? It might get worse as well. Now, another more signs and symptoms you got to think about is when you talk about when you're doing your assessment, right? You always hear the, pulses and neuro and motor and sensory, right? Well, that's something we got to think about, right? Think about when we talk about the assessment for the patient. Are we going to be checking? Is the skin pale? That's a sign. Is it pulseless? Is there delayed cap refill? Is there a lack of motor or sensory, some kind of paralysis going on? Maybe is there pins and needles, right? The numbness to it. Okay. These are all signs and symptoms that might develop because of compartment syndrome. So when you're looking at an injury that might not look that gets that bad, you have to start thinking, okay, but the patient's complaining of really bad pain, severe pain, and it's maybe they're saying it's burning, or maybe it gets worse when you touch it, or if they try to move it at all, and it's also maybe cap refill is delayed, or the pulseless or very, very weak pulse, maybe it's numb, or even totally like they can't move it at all, like there's no motor or sensory going on, then seriously consider the fact that they might be having compartment syndrome there. Okay, so real quick on management for this. What are we doing out in the field in EMS? This is actually, and I put this in the kind of the comments. This is something that's kind of a surgical thing, right? It's a surgical emergency. They need to have surgery done. So for us in the field, most of it is pretty limited, right? We want to make sure the airway, the breathing, circulation, of course, as we always do, right? But when you recognize it quickly, you can relay your findings and your suspicions to the emergency room, even on the radio when you're en route to the hospital, or maybe as soon as you get there, right? Keep in mind, guys, even though we can't always do as much as we would like to do for the patients, sometimes recognizing something that we know the hospital can do for them and relaying that to the hospital could be an immense benefit. Think about sepsis, right? How we now with sepsis, we kind of alert the hospital way ahead of time. We're coming in with a patient that might be septic, right? And that's something we can be doing with compartment syndrome as well. All right. I mean, yeah, we can remove restricted clothing, remove restrictive jewelry, immobilize, fractures, even give cold therapy, ice packs if we feel that might be beneficial. And if you're a paramedic, you can give pain management right on the way to the hospital. But again, not much we can do in the field. The important thing, and the reason why I want to bring this up during this session today, this Facebook Live, is to just talk more about the fact that we need to recognize it, right? Recognize it so that we can pass that information on to the hospital. Okay, guys, I'm going to end it there. If you like this type of stuff, you want some more content to help build your knowledge and be better at EMS, go join me over at Turbomedic as an insider. You go to myturbomedic.com and you can become a free member there and get some more content on how to build your knowledge base. So I hope this is kind of helpful. Hope this helped out a little bit, guys. As always, comments, concerns, leave them below. And as always, I am Jim Hoffman for EMS Office Hours, EMSSEO.com, and of course, Turbomedic.com. Stay safe.